Okay, imagine this. You're recovering in a hospital, maybe even in palliative care, right?
Yeah.
And suddenly there's a wagging tail or maybe a soft puh, and it's actually part of your healing.
Yeah. Or maybe you're just trying to figure out healthcare stuff, policy, and you see someone with an animal. What's that all about?
Exactly. What does it mean? There are so many nuances here.
It's fascinating. And yeah, it's becoming more common, but honestly, there's a lot more going on than just, a friendly animal visit. The differences really matter.
Absolutely. So today in the deep dive, that's our mission. We're going to unpack this whole evolving, sometimes pretty surprising role of animals in healthcare, especially in places like palliative and hospice care.
Right. We want to shed light on the benefits, the real evidence-based ones these interactions bring.
And help you finally get straight the, let's be honest, often confusing differences between all the types of assistance animals out there.
And crucially, walk through the practical steps, the safety stuff that needs to happen to keep everyone safe. Patients, staff, the animals themselves.
For this deep dive, we've got some really solid sources. We're talking official guidelines from groups like the Iowa Department of Health and Human Services, the CDC.
Yep, Centers for Disease Control, APIC, that's the infection control professionals, and SHEA, the healthcare epidemiology folks.
Plus, we've got research reviews looking at animal therapy and real-world stories from hospice programs, animal certifiers like Pet Partners.
So yeah, a pretty rich mix.
So get ready. Hopefully you'll get some real clarity on something that's, well, way more nuanced and maybe even more heartwarming than you first thought.
Okay, let's start big picture. Why animals in healthcare anyway? What's this human-animal bond thing all about, especially when people are vulnerable?
It's more than just pets make you happy, isn't it?
Yeah.
The science behind it is pretty profound.
Oh, absolutely. It's tangible. Like, emotionally and psychologically, the evidence is clear. Interacting with animals, it can genuinely reduce stress, anxiety, depression.
Really? How does that work?
Well, research from Harvard, that's the Human-Animal Bond Research Institute, shows pet owners literally laugh more. In those interactions, they can actually lower stress hormones, like cortisol.
Wow. So it's a chemical thing.
It's a real biological response, yeah. Not just a feeling.
And it goes beyond just how we feel inside, right? There's a social angle, too.
Big time. Animals are amazing for tackling social isolation and loneliness. That same Harvard survey found 85%, 85, believe pets help reduce loneliness.
85%.
Yeah. And 76% said it helps with social isolation. For a lot of people, especially older adults maybe, they give this sense of purpose, meaning, which is huge when you're facing health challenges.
That makes so much sense. And then there are the physical benefits.
Definitely. Just petting an animal can release those feel-good hormones, serotonin, prolactin, oxytocin, endorphins.
The cuddle hormones.
Exactly. And that leads to a calming effect. It can lower your blood pressure, slow your heart rate. And bigger picture, like dog ownership specifically, it's linked to lower obesity rates, more physical activity.
Right, the walking.
Yeah, one study found dog walkers were 34% more likely to get their 150 minutes of walking in each week.
Okay, that's pretty convincing.
And wait, get this, 69% more likely to do any kind of physical activity?
Wow, that's a lot. And you mentioned resilience, healing.
Studies suggest a link between having pets and a lower risk of cardiovascular disease, lower mortality overall, even better survival after coronary artery disease.
Really?
Yeah, there was one 20-year study found cat owners had a significantly lower risk of death from cardiovascular problems.
Cats saving lives. And this isn't new, you said.
Not at all. Florence Nightingale, way back in the 1800s, she saw it. She wrote that a small pet animal is often an excellent companion for the sick. She knew the emotional lift they provided.
So history backs up the modern science.
Pretty much. And these aren't just numbers on a page. They translate into really powerful real-world stories.
Yeah, tell me about those. How does this actually play out?
Okay, so take Martha. Hospice patient, loved cats, but couldn't have one where she lived in assisted living.
This is tough.
So the hospice team, Inhabit Home Health and Hospice, they actually brought in a real kitten for a day visit. Martha loved it, called him Tiger.
Oh.
But here's where it gets really interesting. Later, they got her a robotic AI therapy cat named Princess.
A robot cat, seriously?
Seriously. 60 sensors, purred, blinked, could even be programmed to only respond to Martha's voice.
Whoa.
And Princess became this beloved companion for her, really helped with the loneliness, the anxiety. It's this weird, cool blend of tech and that animal bond thing.
That's incredible. What else?
Well, there was Mia, another hospice patient. She was petting Hank, a therapy dog, and it made her start talking about her first dog, Snowball. Just brought back happy memories, helped her forget her illness for a
Big
bit.
connection, right? Just immediate comfort.
Exactly. Or Betty, 72, cancer patient. Hadn't really laughed in months, but she started playing dress up with Hank, putting her fancy scarf on him,
Oh my gosh.
and just giggled and giggled. Or Sarah, a young MS patient, couldn't talk. But when Brooke, another therapy dog, visited, huge smile, visibly relaxed.
It really underlines how therapeutic it can be. Not just nice, but actually doing something.
Right. It really drives home the research. It's genuinely beneficial. Which, okay, brings us to a key point.
Right.
If animals are showing up more in healthcare, how do we tell them apart? Because the definitions, the rules, it gets confusing fast.
You are not kidding.
Yeah.
It can make your head spin. But we need to understand these distinctions, right? For patients, for staff.
Absolutely crucial. The rules, the expectations, they're very different for each type.
Okay, let's break it down. First up, service animals. What are they?
Okay, service animals. Legally, these are defined by the ADA, the Americans with Disabilities Act. Key thing. They are individually trained
Trained for what?
to do specific work or tasks for someone with a disability. That could be physical, sensory, psychiatric, intellectual. Think guide dogs, hearing dogs, seizure alert dogs.
Got it. Specific job.
Exactly. They're basically working medical equipment, not pets. And under the ADA, it's specifically dogs. Well, dogs and, bizarrely, miniature horses in some cases.
Miniature horses.
Yeah?
Okay.
It's rare, but yeah. And importantly, staff can only ask two questions. Two.
What are they?
Is the dog a service animal required because of a disability? And what work or task has the dog been trained to perform? That's it.
You can ask what the disability is.
Nope. Cannot ask about the disability, can't demand paperwork, ID, or make them show you the task. Very protected.
Okay, so service animal.
Yep.
Trained, specific task, ADA protected, mostly dogs. What about assistance animals? Is that the same?
Close, but not quite. Assistance animals is a broader term, mainly under housing laws, like the Fair Housing Act.
Broader, yeah.
It includes both service animals and emotional support animals, or ESAs.
Ah, okay, so ESAs fit under this umbrella.
Right, but here's the difference. Assistance animals, particularly the ESA part of that category, are not necessarily trained for specific tasks. Their role is more about providing comfort, support, helping with depression, anxiety, that sort of thing, just by being present.
So no specific task training needed for an ESA to be an assistance animal.
Correct. And unlike service animals under the ADA, they aren't limited to dogs or mini horses. And crucially, they aren't considered pets in the context of housing rights, but they don't have the same public access rights as ADA service animals.
Okay, so service animals are a type of assistance animal, but with more training and rights. Then what about therapy animals? We hear about AAT and AAA.
Right, good distinction. AAT is animal-assisted therapies. These are actual goal-directed interventions. The animal is part of a formal treatment plan.
Like physical therapy, but with a dog.
Sort of. The animals are usually certified, often through groups like Pet Partners or Therapy Dogs International. They are trained, and importantly in this context, they are considered pets.
Ah, so these are pets, unlike service animals.
Right, and the sessions are documented, planned, have a set length, there's a therapeutic goal.
Okay, and AAA, animal-assisted activities.
That's a bit less formal. Think motivation, education, recreation, enhancing quality of life.
Like just visiting to cheer people up.
Pretty much. Delivered by trained folks or volunteers, animals are considered pets here too, not limited to dogs, and they don't need that formal task training or have specific goals for every single visit. It's more about general engagement, comfort, fun.
This is, wow, it's complicated. And you mentioned these rules change depending on where you are.
Oh, hugely. And internationally, it's all over the place. Like, the U.S. has those strict limits on what you can ask about a service animal. But in the EU, Canada, New Zealand, parts of Asia, they often do require proof of training from specific organizations, documentation.
Why does that matter so much? What problems does that inconsistency cause?
Well, one big one is the issue of fake service animals, particularly in places with looser verification like the U.S. sometimes.
People just putting a vest on their pet.
Exactly. And untrained animals can cause real problems, barking, having accidents, bothering people. It makes things harder for folks with legitimate, highly trained service animals.
I bet. I've heard airlines have cracked down.
Yeah, some have totally banned emotional support animals now, partly because of this confusion and misuse. They often now require proof of training and vaccinations just for actual service animals to fly in the cabin.
And for ESAs, The range of animals can be wide.
Under some definitions, yeah. Beyond dogs and cats, people have tried to claim peacocks, kangaroos, snakes, pigs. You've probably seen the stories.
Oh, I have, which definitely complicates things in public spaces.
For sure. Okay, so we've talked about the benefits, which are huge, but we have to talk about the flip side, the risks,
Yeah.
especially in healthcare.
Right. Bringing animals into hospitals. There must be downsides to consider.
Definitely. The biggest one is zoonotic diseases. Those are diseases that spread between animals and people.
How common are those?
Well, scientists estimate that over 60% of known human infectious diseases, they come from animals, and 75% of new or emerging ones.
Whoa. That's a lot higher than I would have guessed. 60%.
It is. So how do they spread in a place like a hospital?
Yeah, how?
Several ways. Direct contact is obvious. Petting, saliva, feces, bites, scratches.
Okay.
Indirect contact, touching surfaces the animal contaminated. Think floors, chairs, bedding.
Right.
Vector-borne, like from ticks the animal might carry in, though less common indoors. Maybe food-borne or water-borne if things get contaminated. And the animal itself, its fur, its body, can just carry germs. They call it being a fomite.
So even a healthy-looking animal could be carrying something.
Absolutely. They can shed germs without showing any signs themselves, and certain people are at higher risk for getting really sick from these germs.
Who needs to be most careful?
Kids under 5, adults over 65, anyone with a weakened immune system like many hospital patients and pregnant women.
So protecting them is key. What kinds of germs are we actually talking about?
Things you probably heard of. Bacteria like Campylobacter, Salmonella common in food poisoning, viruses like rabies, though vaccination helps there, parasites like Giardia, fungal stuff like ringworm.
And lots of animals can carry these.
Yeah, cats, dogs, birds, reptiles, rodents. The sources are clear. Is it possible an animal coming into your facility has one of these? Yes, definitely possible.
Okay, germs are the big one. Any other risks?
Well, the physical stuff bites, scratches. Allergies are a big deal too, affects maybe 15% of people, and just phobias. Some people are genuinely terrified of dogs or cats.
That's to be respected too.
For sure. And one more thing, MDROs, those multi-drug resistant organisms. Superbugs. It's not just animals that can carry them, obviously. Family members, staff, anyone walking in can carry things like MRSA. The goal is minimizing risk from everywhere.
So given all this, how do healthcare facilities make it work safely? How do they balance the amazing benefits with these real risks?
It really comes down to having solid policies, written policies, program-specific infection prevention rules. And they need to be developed carefully, ideally with input from lawyers and vets.
Makes sense. What should those policies say about the animals themselves?
Okay, health standards are key. Animals need up-to-date health records, vaccinations. They have to be free of any skin issues, open wounds, clean, well-groomed.
No puppies jumping around.
Generally, no. Younger animals, say under 1 or 2 years, are often discouraged. Their behavior is less predictable. Also, they shouldn't be fresh from a shelter, ideally in a stable home, for at least 6 months.
Why 6 months?
Just to ensure they're settled, their health is stable, their temperament is known. Speaking of which, regular temperament checks are vital. Make sure they can handle the hospital environment without getting stressed.
And what about patients? Are there times when animal visits are just not okay?
Definitely. Exclusion criteria are important. Patients with known allergies, obviously. Open wounds, burns. Anyone with a tracheotomy. People who are severely immunocompromised.
Okay.
Or patients who are agitated. And anyone on special infection precautions like for TB, Salmonella, MRSA, gotta protect everyone.
So the handler, the person with the animal, they have a big job too.
Huge. They need to make sure the animal only interacts with the intended patient. Never leave the animal alone with a patient. Basic safety.
Right.
And follow standard health practices themselves. Plus, keep visits reasonable, usually max 1 hour. Animals get tired too, and a tired animal might get nippy or stressed.
That makes sense. What about cleaning? Hospitals are obsessed with cleaning.
As they should be. Routine cleaning and disinfection of surfaces, floors, chairs, anything the animal might have touched with proper hospital-grade disinfectants after the visit is critical.
And hand washing.
Oh, absolutely. Number 1. It's highlighted everywhere as the best way to prevent the spread of zoonotic diseases. Before and after touching the animal, everyone. Patient, staff, handler, everyone.
Simple but effective. What about letting people know an animal is around?
Yeah, communication helps. Clear signs saying an authorized animal is present. Reminders about hand hygiene.
And getting permission.
Crucial. Need consent, oral or written, from the patient or the representative. Ideally, get the doctor's okay too. Document everything. It's about respect and safety.
Now, you mentioned something earlier that sounded surprising about not routinely screening therapy animals for certain germs like MRSA. That seems counterintuitive.
It does, right. But it's a really interesting point from the guidance. Routine screening for things like MRSA or C. diff isn't always recommended.
Why not? Wouldn't you want to know?
Well, the problem is animals can shed these germs intermittently. So a negative test today doesn't guarantee they're not shedding tomorrow. You get false negatives.
Okay.
And if you get a positive, what do? Treating the animal might not even work long term, could contribute to antibiotic resistance. It's complex. So the focus shifts back to really strict hygiene, careful handling, and following all the other policies rather than relying solely on screening tests that might be misleading.
That's a really important nuance. So the focus is on behavior and hygiene, not just tests. Okay, so wrapping this risk part up. Personal pets visiting, petting zoos coming to the hospital. Good idea or bad idea?
Generally not recommended. Personal pets, petting zoos, especially with farm animals, they carry higher zoonotic risks, less predictable behavior, no specific training for that environment. The controlled, certified programs are really the way to go for safety and benefit.
Got it. Wow, this has been a really thorough deep dive. We've covered a lot.
We really have. From the amazing benefits, the science behind that human-animal bond.
To untangling those tricky definitions, service, assistance, therapy animals.
And then digging into the risks and, crucially, the practical ways to manage them safely.
It's so clear that while the potential upsides are huge, especially for patients in tough situations, you absolutely need careful planning, strict rules, and everyone following best practices.
Absolutely. It really shows how something seemingly simple, like bringing an animal in, can have this powerful positive impact, but it requires real thought and effort to do right.
Definitely. So as we wrap up, here's something to think about building on all this. We know the benefits, we know the risks.
Yeah.
How might healthcare places of the future be different?
What do you mean?
Well, instead of just having policies to allow animal visits, what if facilities were designed from the ground up to actually integrate these therapy animals seamlessly into the actual healing environment?
Moving beyond just visitation policies.
Yeah, towards spaces that are truly animal inclusive, designed with that interaction in mind from the start. What could that look like? And what could it achieve for patients, for staff, for everyone?
That's a really interesting thought. Designing for the bond, not just accommodating it. The potential there is pretty exciting if we do it responsibly.
It is. Lots to think about. This is definitely just the start of a fascinating conversation. We hope you keep exploring this evolving role of animals, both in healthcare and just, in our lives.